blood vessels and circulation. Cardiovascular system. 2. For student copy. Circulation of blood. Left side heart aorta, branches of aorta, arteries, arterioles, capillaries, venules, veins, vena, cava. Right side of heart, pulmonary circulation. Left side of heart. Arteries, any blood vessel carrying blood away from heart. Designed to withstand higher pressure than veins. Elastic. Must swell to take up blood expelled by the heart. Swelling stretches elastic tissue and keeps the blood pressure fairly high between heartbeats. Small arteries, arterioles, have muscles that control their diameters, precapillary sphincters, used to control blood flow through an organ. Capillaries, where materials delivered to / from cells blood. Walls, one squamous cell thick, so diffusion very fast. Not elastic. Types of capillaries. Veins, any blood vessel with blood flowing toward the heart. Low pressure vessels. Can expand to accommodate differing volumes of blood flow. Contain valves to stop backflow of blood. Cross-section of vein with valve. Comparing arteries and veins. Blood flow. Active organs like the liver, brain, kidneys have high blood flows at rest. Kidney, 25% of cardiac output. GI tract and liver, 25%. Muscles, circulation at rest, 20%. Brain, 15%. Adaptions for exercise. During exercise, blood flow to active muscles greatly increases, up to 80% of cardiac output. Blood flow to skin increases or decreases to regulate body temperature. Blood flow through organs. Regulated by nerves and chemical agents. Both cardiac output and blood vessel diameter controlled by hormones and nerves. Controlled by ANS. Increasing blood pressure can increase blood flow. Increasing blood pressure increases cardiac output, constricts many arterioles, more blood volume to other organs. Pulmonary circuit, circuit of blood vessels from heart, lungs, heart. Right ventricle of heart pumps blood through pulmonary trunk, branches into right and LT pulmonary arteries, smaller arterioles, capillaries that surround the alveoli, little air sacs, where oxygenation of RBCs and get rid of carbon dioxide. Pulmonary circuit, cont'd. From capillaries, venules which merge into larger and larger veins until they merge into the pulmonary veins. 2 pulmonary veins from each lung empty into LT atrium. Aorta, ascending aorta, right and LT coronary arteries, aortic arch. Begins at aortic semilunar valve. Right and LT coronary arteries. Supply right and LT sides of heart. Aortic arch. 3 important branches: brachiocephalic trunk, LT common carotid, LT subclavian. Descending aorta. Travels posterior to heart. Portion in thorax called thoracic aorta. Portion in abdominal cavity called abdominal aorta. Common carotids branch into external carotid arteries. Supply blood to neck, esophagus, pharynx, larynx, lower jaw, face. Internal carotid arteries. Supply blood to the brain, with the right and LT vertebral arteries, branches of subclavian arteries. Arteries of upper extremities. Axillary artery. Branch of subclavian artery. Becomes brachial artery in the arm. Branches into radial, pulse and ulnar arteries in lower arm. Branches of the abdominal aorta. Descends slightly to the left of the vertebral column. Retroperitoneal. Branches. Celiac trunk, 3 branches. Lieutenant gastric artery, stomach. Splenic artery, spleen, stomach, and pancreas. Common hepatic artery, liver, stomach, gallbladder, and duodenum, branches of the abdominal aorta. 2. Superior mesenteric artery. Pancreas, duodenum, small intestines, most of large intestines. 3. Inferior mesenteric artery. Terminal portion of the colon, sigmoid colon, and rectum. Branches of the abdominal aorta. 5 paired arteries from abdominal aorta. Inferior phrenic arteries. Inferior surface of diaphragm. Suprarenal arteries. Adrenal glands. Renal arteries. Kidneys. Gonadal arteries. Testicular or ovarian. Lumbar arteries. Vertebrae, spinal cord, abdominal wall. Iliac arteries. Abdominal aorta branches into right and LT common iliac arteries at L4 level. Each branch is internal and external iliac arteries at level of lumbosacral joint. Internal iliac arteries. Bladder, external genitalia, uterus, vagina. External iliac arteries. Blood to lower extremities. External iliac arteries. When cross over to medial surface of thigh become femoral arteries. Branches to deep femoral and superficial femoral. When reaches knee becomes popliteal artery. Where it branches posterior and anterior tibial arteries. Posterior tibial artery divides medial and plantar arteries. Arteries of the lower extremities. Superior and inferior vena cava. SVC, large vein that receives blood from upper body, head, neck, upper limbs. IVC, large vein that receives blood from the lower body, lower limbs, pelvis, abdomen. Both return blood to right atrium. Systemic veins. Internal jugular descends parallel to common carotid arteries, brachiocephalic veins just as they merge with the subclavian veins, veins of the upper extremity. Radial and ulnar veins, parallel arteries of same name, then merge to become brachial vein, axillary vein, subclavian vein. Vein draw blood from median cubital. Veins of the abdomen and pelvis. External iliac veins receive blood from the lower extremities, greater than join with internal iliac veins to form the right and LT common iliac veins, fuses with the IVC.